Good morning, everyone, and welcome to our COVID-19 policy employee immunization webinar. Just going to let our waiting room folks get in, and we'll be starting in just a couple of minutes. Well, good morning, everyone. My name is Krista Ross. I'm CEO here at the Fredericton Chamber of Commerce. I'd like to thank everybody for joining us today. There's a lot of interest in learning more about COVID-19 employee vaccination policies. And we're very fortunate today to have Chamber members MC Advisory and McInnes Cooper here to help us learn more about these types of policies. I just want to remind everyone that this session is being recorded, and we're going to upload the recording to our YouTube channel, and that will probably be the first of next week. So if there is information that you want to recall, you'll be able to refer back to it once we post it to our YouTube channel. At the end of the session, we're going to have a Q&A. So I would welcome you to put questions in the chat and direct them to myself. I'll be moderating the questions. I believe the option in the chat is to send them simply to the hosts or to myself. So if you want to go ahead and put your questions in there as we go along, when we get to the end, we will review those questions. And we're going to ask that you keep your mics muted for the webinar. And I guess before I introduce our guest speakers, I wanted to mention just a little bit about a project that the Fredericton Chamber of Commerce, along with other chambers of commerce in the province, are working on, and that is that we are the distribution points for rapid testing. Those rapid tests are being provided by Health Canada through the province of New Brunswick, and we encourage those who may be interested in this type of testing for asymptomatic people. If you want to have a regular testing program for your employees, you can access these tests by filling out an application form, which is easily found on our website. And you commit to a few things. One is to pick your group of people, test them regularly, assign a test lead, and who will be responsible for the program within your business. You need to report the findings, of course, anonymously to us each Friday. And that would be simply, you know, our company implemented 10 tests and we got 10 negative results. And you have to promise to dispose of them in a responsible manner. So it's a very simple program, and it's one that we are hoping will make our members and non-members alike, businesses and not-for-profits with fewer than 300 employees, feel more safe and give a sense of peace of mind. Additionally, of course, there are certain businesses that are currently required to check proof of vaccination and government-issued photo ID that are now required to implement these tests twice weekly to their unvaccinated employees. So we have been getting a large uptake on the program, and we encourage you to have a look at our website if you're interested. So without further ado, I'm going to introduce our speakers. Tanya Tinsky, Karen Lockerbie, and Dominique Fontaine. The issue of vaccination policies is really a hot topic for our members, and requiring employees of non-essentials to be vaccinated or regularly tested has created a new angle. And I'm sure that we're going to hear lots of great information from our presenters on key issues that you really as an employer need to think about in creating policies related to COVID-19. So you'll leave the session with an understanding of the framework that guides employers in creating workplace policies, where to start in your policy development, and why you should think about implementing a policy to keep pace with the ever-changing landscape of COVID-19. So I'm going to introduce our speakers. Tanya came to MCA with extensive knowledge and understanding in all areas of human resource management, both strategic and operational levels. In her last role, she was Executive Director of Human Resources and Pharmacare for Health PEI. She was responsible for leading strategic human resource and pharmacare initiatives and best practices for the province's largest employer. She also provided leadership for HR with the Department of Education and Early Child Development for the province of PEI. And her focus on results led to a track record as a highly capable change agent, a forward-thinking leader. She's well respected for her ability to understand the organizational, strategic direction and operationalize it on the front line. She values relationships built on trust and integrity through fostering transparency and engagement. Additionally, Karen, over the past 16 years, has developed valuable expertise leading policy, regulatory, advisory, and operational teams within large government organizations in both Australia and Canada. She has a track record of ensuring compliance, providing strategic advice, leading policy and regulatory reforms, and successfully delivering complex projects involving government and industry stakeholders. Karen's known for fostering collaborative relations and achieving impactful outcomes for her clients. She has a unique experience because she advised the New South Wales safety regulator on the development of regulations, guidance, and training for workplaces during H1N1 pandemic of 2009 and the MERS pandemic of 2014. More recently, she has advised private and public sector organizations here in Atlantic Canada on business continuity, planning, and health and safety compliance as it relates to COVID-19. And our third speaker, Dominique, a fully bilingual lawyer with a practice focused on labor and employment law. She assists employers daily in offering strategic advice on various legal questions, including the duty to accommodate, human rights, occupational health and safety, terminations, and the development or the application of internal policies. She regularly presents and speaks on these subjects and writes legal updates on labor and employment law for McInnes Cooper. Her litigation experience extends to wrongful dismissal cases, and she has appeared before the New Brunswick Court of Appeal, the Court of Queen's Bench, and Small Claims Court here in New Brunswick. She's a member of the Chartered Professionals in Human Resource New Brunswick, the Law Society, the Canadian Bar Association, and she's currently a board member for Downtown Moncton Inc. I will tell you again that both MC Advisory and McInnes Cooper are proud members of the Fredericton Chamber of Commerce, and we're very appreciative of the time that these ladies are taking today to help us understand the intricacies of COVID-19 policies for our employees. So without further ado, first up, I'm happy to invite Tanya Tinsky to begin her presentation.
Great, thank you so much, Crystal. And thank you for inviting us to be here. It's my pleasure to introduce our agenda today. First, I just want to review that Karen Lockerbie, she is an MCA senior advisor, and she's going to be walking us through an understanding of the global, national, and also local context of COVID-19. Then she'll pass that over to Dominique, and Dominique will provide those legal considerations and the context around COVID-19, things that you need to be considering when you're developing your policy, and how that impacts your employees in general. And then that will be finally passed over to me, where I will be providing a back to the basics, so 101 practical presentation with respect to how do you approach policy in general and develop policy, and then we will layer on the context of implementing an immunization policy during that part of the presentations, and we'll have some other considerations to leave you with when you think about COVID-19 and your workplace. And as we said earlier, we'll certainly give time for some questions and answers. So before we get started, I do want to provide a land acknowledgement, and I do acknowledge the land upon which I'm located here in Newfoundland today is unceded Mi'kmaq and Beothuk territory, and I pay my respects to the Mi'kmaq and Beothuk people in this territory, past, present, and future. So thank you for that, and I will pass it over to my colleague, Karen.
Thanks so much, Tanya. Hi, everyone. It's a pleasure to be here with you today. Like me, many of you may stay tuned to the regular briefings by Dr. Russell and Premier Higgs to see what the latest updates are. So we're going to begin our presentation today with an overview of the public policy context of COVID-19 and vaccination, because it is really the public policy that is shaping our day-to-day experiences living with the COVID-19 pandemic. So broadly speaking, public policy is a course of action, laws, and rules that are created by governments in response to real-world issues and influences, in this case, the COVID-19 pandemic. Pandemic public policy is an ever-changing and very broad topic, and as you'd all be aware, there's many differing perspectives on vaccination. So my goal today will really just be to provide you with a high-level overview of the public policy framework and context that's shaping the more specific legal and workplace policy considerations that Tanya and Dominique will speak with you about shortly. So let's begin with the global overview. If you can believe it, the global pandemic is already in its second year, and although vaccination numbers are increasing, overall governments in most countries are still struggling to fully vaccinate their populations. At the G7 summit in July, world leaders of the 7 wealthiest countries reaffirmed a commitment to reaching at least 70% vaccination in their own nations, pledged more than 1 billion vaccine doses to assist poor nations, and committed to ongoing funding for research initiatives to increase vaccination and address new variants that continue to emerge in an effort to bring COVID-19 closer to an end. International organizations such as the WHO, together with governments and manufacturers, are continuing to work to bring COVID-19 under control through vaccination programs and policies. But so far, only 44.4% of the world population has received a minimum of 1 dose. 6.11 billion doses have been administered globally, and only 2.2% of people in lower income countries have received 1 dose. These ongoing vaccination challenges are largely attributed to production costs, pockets of anti-vaccination activism, children under 12 being ineligible, and emerging new variants. We're also beginning to see a global trend that people are generally growing weary of COVID-19 protocols. Some citizens are becoming quite vocal about relaxing vigilance on physical distancing, mask wearing, and other public health interventions. And some are calling on governments to return things to normal with the increasing vaccination rates. On the other hand, we also hear people asking for governments to proceed cautiously with some safety measures staying in place while the case numbers continue to fluctuate. In some countries, although definitely not all, domestic and international travel is beginning to increase. We're seeing gathering restrictions ease, and governments are attempting to further progress their vaccination programs and reopen the economy more fully through the introduction of proof of vaccination policies, certificates, or credentials. While vaccine certificates may seem like a new concept, the reality is that they've been around for years and they're frequently used all around the world. Take, for example, the yellow fever vaccine that's required for anyone who wishes to travel to countries such as Venezuela, Congo, or Panama. And here in Canada, most provinces still require families to confirm their children's immunization status before permitting them to begin school. So the public policy position here in Canada is generally in line with most large countries, but overall we're seeing that Canada has fared better than some that have been less fortunate or that were slower to react. So federally, here in Canada, the federal government has stated that public policy objectives of Canada's COVID-19 response and its vaccination program are to minimize serious illness and death, limit societal disruption, reduce burden on healthcare resources, and to promote economic stability and recovery. The government has said that vaccination is the most effective tool to reduce the risk of COVID-19 for Canadians and to protect broader health. Canada's vaccination rates are amongst some of the highest in the world, and our government has made clear that vaccination uptake needs to continue if we're going to avoid a further serious wave and the reintroduction of stronger restrictions at both the federal and provincial level. The federal government is also strongly recommending vaccination for all eligible adults, but has not yet made vaccination compulsory for all Canadian citizens. That said, the federal government has recently announced that as early as the end of this month, vaccination will become mandatory for all federal public servants, federally regulated air, rail, and marine transportation sectors, and for certain travelers, including commercial air travelers, passengers on interprovincial trains, as well as passengers on cruise ships. The federal government is still working with stakeholders in determining exactly how those requirements will be implemented, but has foreshadowed that proof of vaccination and other means such as regular COVID testing or masking are likely to be required. The government has also confirmed that accommodations will be made for those who are unable to be vaccinated, such as those who have genuine medical reasons. Our government is also working with all provinces and territories across Canada to introduce secure and standardized proof of vaccination across the country. While most provinces are generally avoiding the term vaccination passports and instead referring to them as proof of vaccination policies or certificates or credentials, it's true that in most provinces we're seeing some form of vaccination proof being made mandatory by governments in one way or another as a condition of entry, attendance, and participation, at least for non-essential services and activities. Just a quick travel update. The federal government of Canada is now allowing Canadian citizens to return from abroad without quarantining, provided that travelers are asymptomatic. They provide proof of 2 doses of an approved vaccination, and they undergo a COVID-19 test within 72 hours prior to boarding the plane. Foreign travelers outside of Canada wishing to enter Canada who are not vaccinated or only have 1 dose of an approved vaccine are not permitted to enter Canada for any non-essential reason. There's currently no federal requirement on interprovincial travel, but there are provincial and territorial rules and restrictions that apply. And at present, most provinces are requiring some form of proof or at least 1 dose of vaccination to enter the province. So looking at a provincial and territorial view, administrative fairness principles were developed back in May by the Canadian Council of Parliamentary Ombudsmen. And the purpose of that is to help provincial governments in developing proof of vaccination policies and protocols to help ensure that there will not be oppressive or unreasonable barriers to citizens accessing essential government services based on vaccination status. At the moment, every province and territory across Canada is in the process of advancing vaccination programs, and they are either tightening or loosening their restrictions having regard to the evolving situation in their respective regions. Many Canadian provinces and territories have begun to introduce vaccination requirements for certain sectors, for example, the provincial or municipal public service, and several have already introduced or are currently considering the introduction of proof of vaccination requirements to again allow people to participate more safely in non-essential activities. I'll run through a few examples. Saskatchewan recently announced that the government is requiring its provincial public servants to provide proof of vaccination no later than October 1st, or they must undergo regular COVID testing with negative results. Like New Brunswick, Alberta recently declared another state of emergency and have reimposed strict and sweeping new measures to combat the 4th wave. And this includes proof of vaccination programs that do place rigorous restrictions on businesses in Alberta who do not require proof of vaccination from their patrons. Newfoundland has introduced the introduction of vaccination passports for all non-essential activities. And Nova Scotia has announced the delay of its phase 5 reopening and is requiring proof of vaccination for people to participate in non-essential activities as of October 4th. The province is also encouraging all businesses to develop their own vaccination policies for their employees. So generally across the nation, we're seeing a rise in universities as well as private businesses publicly declaring support for proof of vaccination or alternative measures instead. By way of example, Canada's Big 5 banks, Rogers, Twitter, Google, Netflix Canada, companies like Precision Pilates and Fredericton, the Harvest Music Festival, and the University of New Brunswick have all publicly announced that they will be requiring mandatory proof of vaccination or regular COVID-19 testing or masking. All have also clarified that accommodation will be made in appropriate circumstances, such as medical exemption. Across Atlantic Canada in all 4 provinces, we're seeing the provinces grappling with an increased number of COVID cases over the past few weeks. Premier Higgs recently chaired the Council of Atlantic Premiers meeting virtually, and in that meeting, the 4 provinces and the premiers of those provinces agreed to work together with the federal government and each other to develop standards for digital proof of vaccination that is consistent across the Atlantic region, and also to develop an accord that will set out guiding principles to enhance collaboration between the 4 provinces to improve healthcare services and leverage the healthcare services amongst the 4 provinces together. So closer still, here specifically in New Brunswick, as you'd all be aware, as of yesterday, 88.4% of the population in New Brunswick has had a first dose of an approved vaccination, and 79.5% have had 2 doses. Despite these great vaccination rates, Vitalite Hospital reports being at 96.4% capacity. And some of the Horizon Health hospitals are reporting it now being at or over 100% capacity as COVID cases continue to spike in the province. Just last week, as you'd be aware, your provincial government announced that due to the climbing number of COVID cases and hospitalizations, the province and public health had no choice but to redeclare a state of emergency and tighten mandatory health orders. And this includes generally limiting contact, ensuring physical distancing is maintained, and also requiring certain businesses and operators to follow vaccination and/or masking and testing policies. In particular, Dr. Russell and Premier Higgs announced that masks are now required in all indoor places. New Brunswickers over 12 are required to show full proof of vaccination or medical exemption, together with government ID, in order to access certain events, services, and businesses where people gather in close proximity or will be sitting for long periods of time. They've also clarified that to be exempt from these requirements, people will be required to show proof of a medical exemption that is signed by a healthcare provider, and has confirmed that orders will be enforced by random spot inspections by enforcement officers, and failure to comply is considered to be an offense and could result in fines ranging from $177 up to $772. I won't go through all the specifics, but if you're interested, you can find further details on your local provincial COVID-19 website. Suffice it to say, COVID-19 continues to create complex and evolving considerations for both governments, businesses, and all types of organizations. And in addition to the obligation to comply with health orders, all workplaces must also consider requirements under the Occupational Health and Safety Act, labor law, and human rights legislation. So there's no doubt that compliance can result in possible penalties, but we also have to consider that it can raise ethical considerations, influence community spread, impact on workplace culture and engagement, and also influence customer patronage. Unfortunately, there's no one-size-fits-all solution to any of this, but as Dr. Russell and Premier Higgs have emphasized, all individuals and businesses within New Brunswick play an important role in helping to manage the health and safety risks associated with COVID-19, and also to support local economic recovery and the more fulsome reopening of local businesses and activities in the region. As such, it's important now more than ever for all organizations to understand the public policy framework, their legal rights and obligations, and to have clear workplace guidance in place in relation to COVID-19 vaccination policies and procedures. So with that said, I'll hand over to my colleague Dominique from McInnes Cooper, and she'll address some of the key legal considerations that she recommends you keep top of mind.
Thank you so much, Karen, and good morning, everyone. So I'm going to talk about the legal landscape that really is applicable when you start questioning whether or not you want a vaccination policy in your workplace, and you're questioning your rights and obligations as an employer to implement such a policy. So there's no question that the hottest topic in employment law this year has been vaccination policies. And certainly in the last, I would say, month or so, my inbox has been bombarded by questions from clients around this specific issues. So what that tells us is that really employers are turning their minds to vaccination policy, and they want to understand what they can and can't do. So in the last week or two, really what has been driving employers to start asking themselves these questions, at least in New Brunswick, is obviously the return of the state of emergency, but also provincial, government introducing legislation requiring or imposing proof of vaccination for some non-essential businesses, as Karen mentioned, and as we all know. So what we're kind of seeing is a little bit of confusion by employers, certainly in the last week or so, because while government is imposing proof of vaccination for patrons in certain businesses, they're not imposing that to employees. So you have a restaurant, everyone who attends the restaurant needs to show proof of vaccination, but the server doesn't need to be vaccinated. So, and the Premier has been quite clear in a press conference that the question of whether or not an employee must be vaccinated needs to be addressed by the employer. So some employers question, why is that? What's the rationale for the government not imposing that on employees too? And I can tell you that for us, for labor and employment lawyers, we weren't really surprised by that move from government, because I would be extremely surprised that government would essentially tell citizens that in order to work, in order to make a living, which we would argue is essential, you need to be vaccinated. So there's a big difference between telling someone you can't go to a restaurant because you're not vaccinated, versus telling someone you can't work because you're not vaccinated. So we do not expect that that provincial government will introduce legislation imposing vaccination to employees. So bottom line is that it's the obligation of individual employers to determine how they want to manage that situation. What we've been recommending for a while now to all our clients is that they must turn their mind to their workplace and to the question of whether or not a vaccination policy is required. And we don't believe that it's prudent at all for an employer, whether you're a small, medium, large employer, it's not prudent at all to not think about that. So in terms of the presentation, what we've done is we've compiled some frequently asked questions that we get from clients all the time, that come up all the time. And I will address that at the end of my section. And the reason why we wanted to address these questions is because our clients are coming to us with these questions, we fully anticipate that everyone on the line have similar questions. So it'd be the perfect opportunity to address those questions. But before diving into the frequently asked questions, I'm just going to provide a legal landscape, an idea of the legal landscape that applies to vaccination policy. So as Karen mentioned, it's not a one-size-fits-all policy. So your policy as a business, as an employer, will differ from another business's policy because your workplaces are different, your employees are different. So I'll just give you an example. We saw in the news that Air Canada has a very strict vaccination policy. So what they've told their employees, and the unions are on board, is that all employees must be vaccinated by such and such a date, or else they're going to face serious employment consequences, including termination. So this is a very, very strict policy that is very specific to their workplace. But if you are a business where your employees are working remotely, it's not at all the same thing. So you may have a completely different outlook on what your policy is going to say. Your policy is not going to be the same as what Air Canada's policy says. So your policy really needs to be tailored to the needs of your business. If you're in a unionized workplace, obviously the collective agreement provisions will apply to the development and implementation of your policy. One of the important things that we tell our clients that are unionized is that you must consult with unions before implementing these policies. But what's been extremely interesting with this pandemic is that actually the big Canadian unions are very much in favor of vaccination policies. And in our experiences to date, unionized clients are actually dealing with very receptive unions. And in some cases, it's actually the unions that are the ones kind of pushing the envelope and requesting these vaccination policies because they want to ensure the health and safety of their members, just like the employer wants to ensure the health and safety of their employees. So also there may be other unique factors that you want to consider for your workplace. So just to give you an example, if your employees are working with a vulnerable population. So if you have employees working with children under the age of 12, that is something that you will want to consider in your vaccination policy. And when you draft your vaccination policy, there's also some privacy issues that come into play, because when it comes to an individual's vaccine status, it is considered to be private health information. So as an employer, you have the obligation to keep that confidential. The law is certainly evolving on that, but I will address kind of how we deal with privacy in the frequently asked questions piece of my presentation. So, and also I'll just say as kind of an introduction, so when we talk about the general legal principles that apply to this whole question of vaccination policies, we'll talk about the legislation, but so our legal opinions have really been guided by cases from the early 2000s that dealt with employers imposing the flu vaccine in the workplace. So it's really based on that case law that we're giving advice to clients, because as it currently stands, there's no cases that have been published either by court, tribunal, arbitrator about vaccination policies. It's going to happen, but it hasn't happened yet. So it's really the flu vaccination case law that is driving, or as the basis of the legal opinion that we are providing to our clients. So we can go to the next slide. In terms of public health legislation, so the provincial government cannot force anyone to be vaccinated. So we're nowhere near the type of society where the government is going to force someone to be vaccinated. For sure, they're strongly encouraging vaccines, and they're putting some measures or I guess consequences to people that are not vaccinated. For example, they're telling people that are not vaccinated, you can't go to the gym, you can't go to the restaurant. So they're certainly restricting access to some services, but that's entirely different than mandating vaccines to citizens. So there's a big difference between the two scenarios. So why are we saying that employers need to turn their minds to whether or not they should have a vaccination policy? And we're saying it's not prudent to simply ignore it. And that's based on your obligations as an employer under the Occupational Health and Safety Act. So under that act, all employers, it doesn't matter the size of your business or the amount of employees that you have. As an employer, you have an obligation by law to provide a workplace that is safe and that is healthy. And there's no question that the sign dictates that a workplace is safer if your employees are double vaccinated. So there's no question. So when we talk about that obligation, and based on the science, that's why we're telling all our clients, you need to think about a vaccination policy. And when we think about that obligation under the Occupational Health and Safety Act, it's also important to remember that it's not only imposed on the employer, it's everyone in the workplace that has obligations under the Occupational Health and Safety. I'm talking employee, employer, external contractors, unions, everyone involved in the workplace. So that's why really that's the basis of our opinion for telling you you're not being prudent, and you're not meeting your obligation under the Occupational Health and Safety Act if you're simply just ignoring this question and not going through the analysis of whether or not a vaccination policy is required in your workplace. So if we go to the next slide, so So I talked about case law a little bit, just to essentially say that there is none on vaccination policies. But I do want to talk about a couple cases that are relevant and that is guiding our legal opinions to clients when it comes to vaccination policies. So there was a case very early on in the pandemic out of Newfoundland that was around the travel ban for because of COVID-19. So in that case, the judge went back to the Spanish flu cases from the Supreme Court of Canada of the United States, and that was a while back. I mean, it was the early 1800s. So what those cases from the United States told us is that, yes, people have individual rights. There's no question, and we recognize that. But when these rights are bumped against the health and safety of society as a whole or at large, then it's the health and safety of society at large that needs to trump. So based on that analysis, that it's the health and safety of society at large that needs to trump, these types of cases have found that travel bans, for example, are reasonable and acceptable because of COVID-19 poses a significant risk to the health and safety of society at large. And we fully suspect that our Supreme Court, the Supreme Court of Canada, would apply the same logic if they needed to address that question. So it's really balancing the interests. And we fully suspect that COVID-19, the balancing of interest would be the same, that the rights of society as a whole will trump over individual rights. We also included just the KVP case. So anyone on the line who works in a unionized workplace will be familiar with this case, which essentially says, that employers can introduce rules in the workplace or policies in the workplace as long as they're compliant with the collective agreement, that they're not unreasonable, that they're clear, communicated in advance, notice of consequences of the breach, and they're consistently enforced. So that's a good point. Like the last one, if you have a vaccination policy, it should be consistently enforced to your workplace with no exceptions. The only exception would be if human rights legislations come into play and there's a duty to accommodate. But as a general rule, if you decide to adopt a vaccination policy, you need to apply it consistently, whether it's unionized or not. There's also a couple of cases that I wanted to talk about that are relevant so that we get a sense of where we are with the law in Canada. So in the early 2000s, there was a number of decisions in Ontario and out west, Alberta and Saskatchewan, that dealt with hospital employees that were required to be vaccinated against influenza. So the large health authorities in those provinces were mandating employees to be vaccinated. And they were saying, if you're not, you have to wear a mask at all times. And we, labor and employment lawyers, refer to these cases as the mask or vax cases. So there was a ton of cases dealing with this issue. So there's a lot of law on that specific issues, but keep in mind that it was exclusive to the health care sector. However, we're of the view that the same legal principles would apply to a vaccination policy. So essentially, there were two categories of cases. They were the cases in Alberta and Saskatchewan. So the arbitrators in those cases, they all determined that these policies were legitimate for employers to adopt because it gave to employees non-disciplinary options. So if you don't, as a person, you don't want to get vaccinated against influenza, you have options. And that's what the policy told you, is that these options is you can either mask at all times. And if you refuse to mask at all times, the policy allowed you to take a leave of absence without pay. So it was non-disciplinary measures that were imposed by the policy. So the employer wasn't telling you if you're not vaxxed and you don't want a mask, you're terminated. No, they were telling you if you're not, you're going to go home without pay until you decide to get vaccinated or you decide to wear a mask or flu season is over. So it didn't have a devastating impact like losing your job. And it was held to be a reasonable alternative by all the arbitrators in those cases. So the arbitrator says it's absolutely reasonable and it's a reasonable way for the health authorities to deal with this question. In Ontario, completely different result. And the distinction between the two cases is in Ontario, there was a massive debate about the science. So in those cases, the big unions, like the nurses unions and others, were strongly arguing that the science didn't lead to an obvious outcome that masking or being vaccinated would have a major impact on the safety of employees in the workplace. The science just wasn't there. That's the argument that they made, and that's the argument that the arbitrators accepted. And as a result, those policies were not upheld. So quite different than the results in Ontario, in Saskatchewan and Alberta. But what we've been telling clients and what we would suggest is that the science on COVID-19 is much better and much stronger, and that it shows that really unvaccinated employees in the workplace have much stronger chances of getting severe consequences from COVID-19. So what we're saying to our clients is, if we accept the science as it currently is, the Saskatchewan and Alberta legal principles are much more reasonable to follow. However, what McInnes Cooper has been telling clients since the beginning is that you need to provide alternatives to vaccination in your policies. And these alternatives cannot be or should not be disciplinary. So if we go to the next slide. So when we talk about the vaccination policies, what are the do's when you turn your mind to a vaccination policies? You have to look at your own workplace, and I've talked about that a little bit in Karen too. So for example, you ask yourself, can your employees work from home? And I gave a presentation last year on that. We've been giving presentations on COVID for a while now, and you know, the focus was whether or not employees have a right to work from home. And our opinion has always been employees don't have a right to work from home. It's not a right. The employers get to decide what the terms and conditions of employment are. So if you want your employees to work from home, if you realize that it works well for your employees, then absolutely you can even impose that on them. And in many cases, we've seen it through the pandemic, and we're still seeing it. Working from home works really well. So you have to determine, if you're a business where that is possible, are you okay with asking your your employees to work from home? And if so, if all your employees are exclusively working from home, you probably don't need a vaccination policy. However, if you have employees that are working from home, but they're coming to the office for meetings, for seminars, conferences, then it's obviously a different analysis, because if you adopt a vaccination policy, we need to apply at the minute that they come into the workplace. Provide options and alternatives. That's the main issue that we always talk about, and that I talked about a little bit. So you absolutely do provide, you need to provide options. Another big piece that will only apply, we focus a lot on it, but it will only apply in specific cases, is the duty to accommodate. So you have to pay attention to those individuals that are protected under human rights legislation, whether it's due to medical or religious reasons. And if so, then your alternative needs to be individualized based on that person and their protected ground. But obviously, the onus is on the employee to show that they have a legitimate reason, and they must provide proof of that reason. And the onus is on them to provide that proof. So they need to provide, you know, a note from a doctor or something like that to show that you need to accommodate them. And we are getting a lot more questions about religious issues. You know, employees are claiming that being vaccinated is against their religion. Of course, we have to look at every single request on a case-by-case basis, but most of what we're getting is not valid at all, in our opinion. Protection of health information, you need to address that in your policy. How are you going to ensure that the proof of vaccination is protected? It's private, it's confidential information. And also consider discipline for non-compliance. So I've been talking about the fact that a failure to vaccinate cannot lead to disciplinary results. But what I'm talking about here is you must keep the ability to discipline if someone fails to comply with your policy. So if someone lies about their vaccination status, or if someone is not vaccinated and they are required to mask and take 3 rapid tests per week and provide the results, but they don't mask and they don't provide the results, that's a breach of your policy, and that can lead to discipline. So, so obviously employees have to follow your policy, and if they don't, then you can absolutely discipline your employees. Make sure that your policy relies on medical evidence, and for unionized workplace, I said that already, consult with your unions. So for the next slide are the frequently asked questions. So one of them, privacy is becoming more and more of an issue. Employees are taking issues with, well, some employees, not a lot, are taking issues with disclosing proof of vaccination, saying that it's private health information. If you decide to have a vaccination policy, which we strongly encourage, I mean, the reality is that if you want to enforce it, you need to be aware of the vaccine status of your employees. There's no way around it. So employees are taking different approaches to how they get that information. So first approach is that some employers are trusting their employees. So they're asking employees, tell me if you're not doubly vaccinated, if you are, if you're not, and they trust their employees with the answer. Obviously, if they lie, that's very much worthy of discipline. But really, we trust our employees all the time, right? So, but if you're not comfortable with that as an employer, there's other options. The second option is a checkbox system. So you assign someone from HR or whoever you decide to assign, that employees show their proof of vaccination to this person, and it's a checkbox. Okay, I've seen it. Yes, vaccinated. So that you don't keep the vaccination records on file. So you're not maintaining medical information. The third option that really more applies, where employers are required to show proof of vaccination so that their employees can go work for a third service party provider, or so I'll give you an example. If you're a daycare and you have your employees that are attending the schools to go pick up kids for the daycare, schools are asking that you as a daycare provide proof of vaccination to the school. So in that case, you need to have the proof of vaccination. Or if you're working for, if you're a contractor for a big site, and the employer at the big site is saying every single person coming onto our site needs to be vaccinated, and we need to see proof, then you really have no choice than to ask for that proof. So if proof is required, you need to ask the employee whether or not they are comfortable with you disclosing that your proof of vaccination to a third party. Most employees are. If the employee is not, you're going to have an honest discussion with that employee and say, well, I can't, you're going to have to be sent to another work site. Or, I mean, the alternative will be a leave of absence without pay, because the reality of it is that the employee will not be able to do his or her work if the third party requires proof of vaccination and you're not able to provide it. Second question, Can employees who refuse to be vaccinated be terminated for cause? Our answer to that has been no since the beginning, for different reasons. But the first reason is that the standard for cause is extremely high. It's very difficult to prove, both union and non-union. So we know Air Canada is saying that's what they'll do, and it will be interesting to see what the law will say on that. But what we're telling our clients is there's a significant risk of liability if you decide to go down that route. And another reason why we're saying that is that COVID is, fingers crossed, a temporary issue. We don't know how long it's going to last, but to terminate someone based on a temporary issue would really undermine any argument that you had cause to terminate. Third question is whether or not employees can be terminated without cause. Unionized workplace, the answer is no. Non-union, the answer is yes. You can terminate someone without cause for not being vaccinated, but you need to pay severance based on the Employment Standards Act and based on the common law. And if you're a federally regulated employer, the Canada Labor Code applies, and you can't terminate without cause. They have the same protection as unionized employees. Do employees have a right to work remotely if they're not vaccinated? As I said, it's not a right to work from home. You can choose to allow your employees as an alternative in your policy to work from home if they're not vaccinated, but it's certainly not a right. If that doesn't work for you, if your employees are unable to work from home because they have to interact with the public or be somewhere to work and they're not vaccinated, and you've determined, that rapid testing and masking doesn't work for you, then it would be a leave of absence without pay. The next question, if citizens are required to show proof of vaccination to go to certain places, why don't employees at those places have to be vaccinated too? I talked about that earlier. The reason why they don't is because it's not legislation that has been adopted by the government. In the legislation, it now says that some non-essential businesses have to require proof of vaccination, but it doesn't say that for employees, and we don't expect that it will. But as an employer working in a non-essential business where proof of vaccination is required for patrons, you may determine that you need to ask your employees to be vaccinated. Is it mandatory or optional to adhere to the government's proof of vaccination policy? It's mandatory. It's in legislation. You don't have a choice, is what we will say. Another, just quickly, some question that I've been getting a lot from client is whether or not in the hiring process you can ask that proof of vaccination be a precondition to employment. And the answer to that that we're giving is yes, but you have to be alive to whether or not there's some human rights issues that may arise. So if someone has a medical exemption, the duty to accommodate also applies at the hiring process, but you can absolutely have that as a precondition of employment for future employees. So I can take questions at the end, but I'll leave it to Tanya to continue.
Great, thank you so much. So in this section, I'm going to provide a back to the basics overview of how to develop policy and then overlay that with specific examples and considerations when you're looking to design your own immunization policy. And as both Dominique and Karen had said, this isn't a one and done. The sand is shifting under our feet, and the guidelines and the boundaries are changing. And so we just really do need to keep our mind to the topic in the weeks and months ahead. So if we want to go to the next slide. So when we're thinking about developing policy, there's usually three things that we need to consider. The first one is that if we need to be in compliance. So that could be in compliance to legislation or if there's a corporate direction that is being implemented. The second is we're seeking a change in behavior from our staff. And the third would be if we need to provide guidance to our staff and how they go about reaching decisions. So next slide. So regardless of those drivers, there's a number of questions that you need to be thinking about. And I won't read all of them, but some of the questions there are, does a problem exist? And if there's agreement on the problem, can anything be done about it? Will it serve to clarify an ethical, legal, or professional practice issue? And if you answer yes to any of these questions, it typically signals that you need to develop a policy. Before you go about developing your policy, though, I would caution you to take an inventory of the policies that exist within your organization or business now, and see if developing your immunization policy will require you to change any other policies that exist, or if there's policies that exist that would be in conflict with the immunization policy. So now in the next section, what I'm going to do is take you piece by piece of developing a policy, just from the most general. You can use this in developing any of your policies, but after each section or each couple of sections, I will then layer in what it would look like if we're developing an immunization policy. So the first section is really the most, what I would consider the most important part of your policy, and it's really talking about your policy statement. So it really states the position of the employer. It has to be clear and specific, and it not only provides direction, but it also proves the basis for which the policy can be evaluated for accountability, efficiency, and effectiveness. So when you're thinking about your policy statement, it's really telling your employees what to do. So consider when you're writing that statement, consider your style, your tone, and try to keep it as short and clear as possible so that it's very understandable for your employees. So we'll take a look at what that may look like when we talk about an immunization policy. So here you'll see it says, my organization is committed to managing whatever your organization name is, to maintaining a safe work environment and to protecting employees and customers from the risk of infection from and complications associated with COVID. Vaccination is recognized as a cornerstone of preventing and decreasing the effects of COVID-19. And whatever your organization is called is committed to comply with the recommendations from your chief medical officer as it relates to COVID. So although there's 3 statements in there, it does hit on your commitment to keeping staff safe through vaccination and also your compliance with the chief medical officer. So it really sets a stage for your policy and how you're going to develop it from there. So the next section is called definitions. And I know when I'm working with some clients, this seems to be a bit of a foreign element of policy development for them, but it is a real critical one from my perspective. Sometimes we think that the most common words are just clearly understood by everyone, but sometimes they're not. Sometimes I will look at a word like an employee, and particularly in this particular policy, it really is quite relevant, because when we want to define and enforce a policy, who is the employee? Does the employee, as Dominique mentioned, does that cover your contractors? Does it cover people who only come in and work casual for you from time to time? Or is it just your full-time staff? It's really important that we're very clear about the words that we use within our policy, so that when we go to enforce it later, it puts you in a better position, to determine if there's been a violation of your policy or not. So the next section is called your policy purpose. So the purpose is really your why. It's why does that policy exist? And it needs to be specific and precise. So you don't want your statement to be general and vague and not necessarily clear. You do want it to be fairly crisp. You want it to be concise. So just keep it to 1 or 2 sentences. And if at all possible, the goal, it be goal oriented, so that you're really stating it in terms of the desired outcomes that you're expecting from your employees. So let's see what that may look like now in the next section. So here I have some definitions. I've defined as an example, and certainly these aren't the only ones that you may or may not want to include, but your customer, your employee, the term immunization, the term personal protective equipment. And here we also have your purpose. So here it can be longer or shorter. Really, I would suggest it can be defined to protect employees or customers from COVID-19 by preventing the transmission and decreasing the risk of COVID-19 outbreaks. You may want to go on and further talk about the purposes to ensure compliance, for example, with the Canadian Immunization Guide or the National Advisory Committee on Immunization. And you would do that if you're in a more high-risk type of organization, such as airlines or healthcare, where those guidelines are very critical to their operations and that they are expected to follow those. Otherwise, your purpose statement may be a bit shorter. So I would consider that what we've just talked about really the hard part of developing your policy, because it does force you to really consider what your position is with respect to your policy on immunization. And the rest, once you have that clear and everybody is on the same page, it makes the rest of the policy go a little bit easier. So this section 4, is really about application. So it is important here to ask, who does this policy apply to? So as I said before, when we talk about employees, we also want to talk about, does it apply to visitors? Does it apply to shoppers? Does it apply to those people who are picking up their children from the daycare, as Dominique suggested? All of those considerations need to be thought about and clear in who this policy applies to. And I would say equally important, who does policy not apply to? And if you clearly know who it doesn't apply to, it would be good to include that inside your policy so that it is clear for the reader and employees when they're looking at it to say, does this policy apply to this situation with this individual? So equally important to make sure you think about who the policy does not apply to. The next section is procedures. And anyone who's developing policy with me will often hear me say that policies and procedures are 2 separate things. Your policy is the what, and your procedure is really the how. However, in this particular circumstance, we really want employees to read this policy and know what to do and have one-stop shopping. So I do think it's important at this point in time when we're developing this policy that we do include some information with respect to procedural information. So really, in here you can talk about, what are the responsibilities of certain individuals and what you may do when exceptions or requests for exceptions come to your desk and how you're going to deal with that. So let's take a look at what that may look like. So here I have the application that this policy relates to all employees of whatever your organization is. And procedurally, we can talk about, it includes accountabilities related to how the CEO is accountable to this particular policy. They may be responsible to implement the policy, but then there may be other responsibilities for managers, responsibilities for employees. For example, employees maybe have the responsibility to ensure that they provide proof of immunization. if you're, to advise their immunization status to their manager, or wear PPE in the absence of immunization. It kind of gets into the mechanics of what's going to happen in your policy. And it's at this point you really do need to decide how you're going to deal with, as Dominique said, those accommodations. And accommodations are based on, it's a human rights driven, and they do need to be considered on a case-by-case basis. But when individuals come to you with a reason, then you need to consider whether or not they are exempted from this particular policy, and what, if anything, will be done for them to comply in a different way. So what is their off-ramp to ensure that your organization or business is as safe as possible, as that's your responsibility. So then we get into monitoring. And we've often heard, the saying, we develop good policies or plans and they sit and collect dust. This isn't the case with this particular policy, because I'm sure, I can guarantee you'll be taking it off, as I said, in the weeks and months ahead, to be able to update and ensure that it is relevant based on the information that we have, or the changing requirements that are placed upon us. But somebody has to be responsible to do that. And so this is where you really define who is going to be monitoring this policy, and for, how often that individual or individuals will be monitoring the policy. And finally, then we get into references. And I include a section on references because, it really lends credibility to how you have approached and developed this particular policy. So here you would list any related policies, standards, as I had mentioned in a previous slide, that may be national or provincial or professional, any legislation that is related to this policy that you brought in under consideration when you were developing it. So let's see what it will look like on our immunization policy. So here for monitoring, I have here X number of years. So you'll see that hopefully on your screen. That's what I would typically recommend. In this particular area, I would say that you're looking at this policy probably once every couple of months, if not as needed. I would probably say every 2 months for the next year probably, or as needed, because things that I do expect will be changing quite frequently. And then also your management team, and what are they responsible for with respect to ensuring, whether it's proof or ensuring that your staff or employees are acknowledging their immunization status. So there could be two pieces in that particular section. And then I offered you a number of different resources that are typically associated with such a policy. So for example, your occupational health and safety legislation, as Karen as well as Dominique referred to earlier, your public health legislation, human rights, and then the Canadian Immunization Guide, National Advisory Committee on Immunization, and the Public Health Agency of Canada, all great resources and maintain very current information and resources that can help inform your policy as well. And if you have any forms or any information, I know some of my clients are wanting to put a preface on the front of their policy to talk about their why they're developing their policy. And they take information from your chief health office, public health office. Sometimes that's not the best place to put it embedded in the policy, because it becomes dated the day you print your policy and it changes. But sometimes you want to put it as a reference at the back. So you could put it in here in your appendix. And some people choose not to have any appendices. So now I'm going to walk you through kind of taking each section and showing you what it looks like in your policy. So at the top, you're going to have your kind of header information that's going to identify your policy and when it's going to, who's approved it and so on. Then you're going to get into your policy statement and your definition. So that really sets the tone for your policy moving forward. Then you move into your purpose. Your purpose is telling you your why. Your procedure is telling you how to go about particular parts of your policy. And the application is who. Who does this policy apply to? And remember, who does this policy perhaps not apply to? Then finally, you get into monitoring and references. So that will, again, ensure that your information and the guidance you're giving to your employees is current if you're monitoring it on a regular basis, and that there's accountability for that, as well as your references that will allow those that are reading it, especially this policy where people are, this is very new for all of you, all of us, and we need to know that we're making those decisions and providing that guidance with good, credible evidence, and providing those references does allow your employees to feel assured that the best information helped inform the policy. So I hope, in this section that it did provide you just some very practical considerations when you go to develop any policy, and particularly the immunization policy. So before I hand it over for questions, I just wanted to talk about a couple of other considerations when we talk about COVID. So I won't read all of them, because I do want to leave some time for us to have a chat and answer some of your questions. But for example, it's not just about your immunization policy. One piece here is around, acknowledgement of immunization. How are you going to ensure that staff who are coming into the workplace as new employees, and those that are in your workplace, and how are you going to monitor that today and over time? And is it going to be the trust approach, or will it be a check sheet, or will it be a form? Things you need to turn your mind to. One big piece, as Dominique had mentioned, is really about remote working. So in remote working, or hybrid working models, as is often referred to today, you need to be thinking about considerations on privacy. Who can work from home? Are you going to allow new employees to work from home, or should they be, through their probationary period, or a time when you feel that they can work more independently? Are you going to do a rotation or hoteling back into the workplace and to other remote or home offices? How are you going to maintain your employee engagement? And most importantly, your occupational health and safety considerations. When your staff go home, and we all just went home when we were told to go home, but now that we are adjusting to how we're going to work in the future, we really still need to be considering that it's a shared responsibility around safety, both from an employee and employer perspective. And how are you going to maintain those obligations when your employees are at home? So those are some things to be thinking about having a respectful workplace policy. We know that with COVID has come a lot of shaming and hate messages and negativity in our workplace. And so if you don't have a respectful workplace, it's probably a good time to start thinking about, incorporating that and maintaining your culture. And paid sick leave moving forward, symptomatic versus confirmed. So when people have symptoms related to COVID, do they go home? Who's paying, like your sick leave? Are we paying individuals to go home, or are they using their sick leave? How are we going to deal with that moving forward, and so on? Like, there's lots of considerations when we think about COVID. So we certainly don't want to think that the immunization policy is where it ends. I think that a lot of what we do from a human resource perspective does need to be looked at again through the lens of COVID, and make the adjustments as necessary. So with that, I will pass it over to our hosts for any questions that you folks may have.
Thank you so much to Tanya, Karen, and Dominique for what a great presentation you provided us today. I have a ton of questions that have rolled in. So what I would suggest, we have about 15 minutes. So if we can keep our answers as brief as possible, that will allow us to get through the questions, and also that these Q&A will be on a recording, which we'll share. There was one question about whether or not we could share the slides, and I have been advised that the slides will be shared to the chamber, and we will share them out to anybody who attended the session today. So the first question that came in was, what if another double vaccinated employee says, I don't want to work with an unvaccinated person. Will you accommodate me?
Maybe I can answer that one. So when we talk about the duty to accommodate, we have to remember, I think that's where a lot of confusion arises, is that the duty to accommodate stems from the human rights legislation. And what the human rights legislation tells us is you can't discriminate based on specific prohibited grounds. So medical issues, physical, mental issues, religious, family status. So being vaccinated or not is not protected under human rights legislation. So if you have an employee saying, will you accommodate me? That goes to the fundamental importance of having a policy, because your answer to that, you're the employer, you get to decide. You get to decide whether or not you want your employees vaccinated. So the answer, there's no, you don't have to accommodate that person. Of course, you need to provide an answer. And if your answer is that you feel your policy addresses the health and safety of all employees, and that a non-vaccinated employee is testing, is wearing a mask, and you feel that's enough, that's the answer. There's no duty to accommodate in that scenario.
All right, next question is, when we talk about medical exemptions or official medical exemptions, which medical professionals can provide this?
Right. So it would be a doctor. It would be, and we've heard all over the news lately that doctors are essentially saying that these exemptions are rare. So it would need to be a note from the doctor that really, so usually it's an allergy to something in the vaccine. So it's very rare, but it needs to be usually it would be from a doctor.
The next question, it says, I have a question for Dominique about the duty to accommodate on the basis of creed. To what extent does an employee making such a request have to align their personal values with an organized community or group? Is it enough that they've adopted the philosophies even if they don't belong? So I take that to mean if someone says, I am adhering to the religious rules, I guess, of a certain organization, but I'm not actually part of it, but I agree with it.
Right. So religion exemptions are very hard. And I'll say that the government is not even recognizing them, right? Government has said the only exemption, well, in New Brunswick at least, the only exemption is medical. So I mean, I think that's risky. I think there are some cases where religion becomes an issue. But in a case like this, if they're adhering by the principles, but they're not part of the organization, I would say that it's not proof that they belong in that group. So, and it's not proof that they are protected under human rights legislation. So for religious exemptions, we would usually ask, the proof would be like a note from the pastor, essentially explaining what the exemption that they're looking for is and why. And we're seeing a lot of requests, but they're not usually legitimate.
All right, the next question is, when you say alternatives to a double vaccination policy should not be disciplinary, who interprets what is disciplinary? As an example, an employee may feel testing regularly is disciplinary.
So who determines? I guess it's the law that determines what is disciplinary or not. So as I said, we're focusing our legal opinions on those cases from the flu vaccine, where arbitrators have said that the alternatives are non-disciplinary. So you're not by asking someone to wear a mask or be tested, you're not disciplining them. You're actually saying there's no problem with you not being vaccinated, but here are the alternatives. So I know that some employees are saying, I'm being targeted because I have to be tested. You're targeting me, and our answer to that is no. We're providing you with an accommodation for not being vaccinated. So it would be the law that determines what is disciplinary, and an employee believing that they are being disciplined is not sufficient.
And I quickly add to that, that the more that the government comes out with what the alternative measures are, the more difficult it will be for people to say, you know, that's targeting me specifically, because the government's putting out public statements about what alternatives may include.
Absolutely.
Okay, just to follow up on the question of creed, the person actually responded and said, not religious, creed. I didn't really know what creed meant, so I looked it up, and the definition I found online was a formula of religious belief. So if there's something other than that that you meant when you asked the question, maybe you could just address what creed is. And I'm going to pop on to the next question. Is it acceptable to allow vaccinated employees to work from home, but require unvaccinated employees wearing masks to work in the office?
Can you repeat that?
Is it acceptable to allow vaccinated employees to work from home, but require unvaccinated employees wearing masks to work in the office?
Well, I mean, I'm not sure I would understand the rationale for that.
Probably really, more based on the position or the requirement.
Based on the position, I think it absolutely is. If you have employees that are vaccinated, that are working well from home, have been working well from home, you can allow them to work from home. It's not an employer's right to work from home. So, and if you have an employee who has not been working well from home, or who has shown that they're not as productive, or who can't work from home, it's absolutely reasonable to have them in the workplace and provide them with alternatives, masking, rapid testing, if they're not vaccinated. Absolutely reasonable.
The next question says, is it reasonable to have employees cover the cost of testing if that is one of the ways I accommodate those that don't want to vaccinate? And I'm going to jump in and say the Fredericton Chamber of Commerce, along with other chambers in the province, are providing free rapid testing to businesses or not-for-profits with fewer than 300 employees. So let the record show that I was able to answer one of these lovely legal questions. The next question, does business vaccination policy supersede human rights or charter rights? If
no.
Not, no.
No.
And it says, if not, why?
Well, the charter is the ultimate law. So anything that is inconsistent with the charter will fail. Human rights legislation is quasi-constitutional. So it trumps any other legislation, I would argue. And any policies, any rules in the workplace need to comply with human rights. But if you incorporate your duty to accommodate in there, it's 100% compliant with human rights legislation. So what we've been hearing is employees saying it's medical discrimination to ask me to be vaccinated. It's not. It's not. And the Human Rights Commission in New Brunswick has put out a document called, I think it's like question and answers, vaccination policies. And their first paragraph is the right to choose whether or not you're vaccinated is not protected under human rights legislation. So there's a lot of confusion on that. People think that it's discrimination, that we're removing the right to choose. We're not removing your right to choose. We're saying if you choose not to get vaccinated, here are the alternatives.
So the next question is, when creating policy on the legal landscape, can we insist employees follow the rules? And if we not, can we discipline them? And what example of discipline can we do? And I know you did mention it couldn't be, alternatives couldn't be disciplinary, but can you address that question?
Sure. So if you have, so the discipline piece, if you have a policy that says, if you're not vaxxed, you must wear a mask and get tested and show us the results. And then you have an employee who fails to do that, who keeps removing their mask or doesn't get tested, so they're not complying with your policy, then you discipline. And when we talk about discipline, it's the concept of progressive discipline. So is it your first time not complying? If it is, then you would get, I would prepare a letter to file saying, this is your first discipline, blah, 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 and it goes up, it's progressive, and it can lead to termination. Because if you're failing to follow policy, employer policy, it's essentially insubordination. So you, as an employee, you need to follow what your employer tells you to do. And if you don't, you will pay the consequences. I mean, it is what it is, and the employer has to apply progressive discipline. And that's a basic discipline rule in employment law.
A question here that's a little bit different. Any suggestion on communicating our policy to clients to ensure they have confidence and feel comfortable in the policies of our business?
Do you want to answer that maybe, Tanya?
Yeah, I have no problem with sharing a policy, but sometimes what organizations and businesses are doing are just putting up like a summary that there is a policy and that, you know, they're abiding by occupational health and safety and the directions of the chief medical office. You don't have, again, sometimes what happens is it gets into the area of that Dominique talked about earlier, where the public is looking for validation that employees are vaccinated. And again, that's not a place you should or could go, but you can certainly say that you have a policy and that you're abiding by the directions of the chief medical officer, as well as any of the, you know, relevant legislation, just to provide confidence that, to the people that you're doing business with.
So the next question is, mandatory doesn't mean legally required, does it? As legislation would need to be passed to require to adhere to mandatory vaccination or testing policy.
Correct. Absolutely. So we call them mandatory vaccination policies. It doesn't mean that if you don't get vaccinated, you're going to get terminated. And the government has not imposed vaccination on citizens, and I don't think that they will in the legislation. So it's not mandatory in the strict sense, which probably leads to some confusion. But no, it's essentially you're mandating that your employees provide you with whether or not they are vaccinated with proof of vaccination, and if they're not, then it's the alternatives.
And the employer, sorry, I wanted to add that the employer is saying that it's mandatory. It's in the title. It's more in title than it is in legislation.
All right, so the next question is, if my employees are required that they meet with various clients around the province who may have various vaccination statuses, how am I providing a safe workplace for my employees?
Excellent question. That's a difficult one. So I think that you need to address that with, if you believe that it's a huge problem, you could address that with some clients and ask them what their vaccination, and that goes with the other question that we had, ask them what their vaccination policies are, and ask them what their alternatives are for individuals that are not vaccinated. But essentially you have to do what's reasonable in the circumstances to ensure the health and safety of your workplace. So it's not perfection. It can be perfection. It could never be perfection. That's not the onus. It's what's reasonable. So that's a tough one, but it's a discussion I think you have with your clients, and also with your employees as to what they feel comfortable doing.
And I would add to that is that, don't forget about some of those other steps that we've been told to take. So ensure where you can physically distance. If you want to add those extra layers of protection with respect to PPE, then layer that on. So there are a lot of steps and interventions that we can take. Think about it, and I come from a health background, and so this would be very common in home care, for example, or sick people in a hospital, where you add layers and layers of protection. And again, there is no perfection, but you do the very best you can to ensure the safety of your employees. So stock up on the PPE. Your vaccine is one part of it, but you can still layer that on and ensure that there's physical distancing where at all possible.
You're on mute.
Sorry. The next question, it says, for mixed use buildings, some of our tenants require proof of vaccine, some don't. Can I just say that everyone needs to have proof of vaccine to keep it to the highest standard? So I think what that means is There are individual tenants inside a building. Some of them are requiring this because of the nature of their business. Others aren't.
Right.
And it's the landlord, I guess, the overall landlord that's saying, can they set a policy that would restrict all of their tenants, or must they leave it up to the individual tenants?
Yeah, I mean, it's not employment related per se, right? Because we're not dealing with employees. I'm not sure what would prevent a landlord from doing that. I don't think that anything would. It's the landlord gets to decide what the rules are of the building, but I think it's a business decision, right? Because you could potentially lose tenants, but I don't see anything that would restrict the landlord from imposing that. Or the landlord could say, here's like the strict minimum that we need in terms of vaccination. Can you confirm that you all have a vaccination policy that meets this strict minimum?
The only caveat I'd add to that is depending on what the nature of the businesses are, right? Because Dominique mentioned you have to have policies that are specific and safety procedures that are specific to your type of business. And so if there was a situation where you had, very different types of businesses in the same building, in a rare circumstances, and I'd emphasize rare given what the topic is, you'd want to be careful as to make sure that it is possible and reasonable for that type of business to do what you're asking them to do.
Next question is, did I hear Dominic correctly when she said unionized employees cannot be terminated under this sort of policy with or without cause? If so, what can the employer do to enforce the policy against a unionized employee?
So unionized context is that you can't terminate an employee, a unionized employee, without cause. That's very basic. It's in collective agreements. So that doesn't mean that you can't terminate an employee or unionized employee for cause. And what I mean by that is if you have a vaccination policy and you have an employee who consistently fails to abide by it, then it's same concept. Progressive discipline applies, and you could potentially terminate eventually the employee for cause, the unionized employees for cause, no question, but you can't terminate without cause. So that's the distinction.
Yeah, and I think just to build upon that, I think the point that Dominique was making earlier is that you can't terminate for the choice around vaccination, but the discipline comes into when you're dealing with compliance to the policy, not compliance of whether or not, or the choice they make around vaccination.
We are at 11:32. We have about 4 more questions. If you guys would like to bang through them, we'll keep going. We still have about 60 people on our webinar that didn't have to go off to another meeting. And I would love to get through these. So is that okay?
Yep. I think it's okay for my colleagues, but I may have to leave in a minute or two because I do have another meeting.
Well, I will give you our official thanks, Tanya, to you, in case you're not here when I do the thank you. This has been very informative and helpful, and we'll all be looking forward to seeing the slides and also watching the video again to make sure that we've absorbed all of this great information. So Tanya, thank you for your part of that. So the person who asked the question about creed, they said that creed is different from religion under human rights legislation, and it may be related to ethical veganism, for example, but not necessarily a religion. So if someone is making a request for accommodation on the basis of creed, it says, is it required that that person be a member of an official group that holds the philosophies or principles? And what the difference is with religion and creed with respect to the requirement for a nexus to an established organization?
Yeah, I mean, it's a tough one to answer without having specifics, right? Because the duty to accommodate is always so specific. So I would say that with creed, you would still need to request that nexus. So just saying that and what we've seen a lot is employees are saying, I believe that I have a right to choose whether or not I'm vaccinated. That's my belief. And you're restricting that belief. But to me, that is not protected under creed.
Okay.
And the Human Rights Commission has been clear on that too. So, I mean, it's difficult. I think we would need to look at it on a case-by-case basis.
I have someone that's saying, and this is an employer who maybe is not in agreement with vaccine policies. They're saying vaccines are not proven to stop infection or transmission. So what makes my workplace safer for others if I mandate vaccines?
Yeah, I mean, I think that's just like a question for a scientific. Okay. I think that if there are doubts as to whether or not vaccination provides a safe work environment, if an employer has any doubts on that, they should seek advice from a scientist or on the effectiveness of vaccine. I think they have an obligation to go down that route and see what the science says on transmission in the workplace.
I have another question about the Abbott Panbio COVID-19, and the person is wondering if that's the test that we're distributing. And yes, indeed, that is the test. Here's a question. This is a very interesting one. If a client asks about the vaccination status of my employee, we're not allowed to disclose that. So how do I handle it?
Right. So I think that you would need to ask the client why it's required. And if they're adamant that it's required, you need to have a discussion with your employee and ask if they're okay with it. And if they're okay with it, you are 100% allowed to do it. The only situation where you're not allowed is if the employee tells you specifically, I do not give you my consent to share my vaccination status with a third party. And if that happens, and I would say it's in quite rare circumstances, general rule, employees are okay with sharing the vaccination status. But if that happens, the employee will need to understand that they can't deal with that client until that client changes their minds or the employee gets vaccinated.
So somebody just shared with me that the New Brunswick Human Rights Commission just put out a press release, and it says in part, however, to claim exemption from vaccination under the ground of creed or religion, a person must demonstrate, one, their vaccination choice is based on a specific religious or spiritual belief system, and two, that they sincerely follow that religious or spiritual belief. In this context, solely stating a personal belief, a personal objection, or a personal conviction not based on religious or spiritual belief is not sufficient to be recognized as a religious right under the Act as the ground of creed or religion is defined in the law.
Right, and that makes a lot of sense. And I fully suspect that the reason why the Human Rights Commission is being so proactive and taking a position is because they're being bombarded by these questions. Right.
I know that we could sit here and ask questions all day long, and we so appreciate the advice and information that you shared with us today. I want to thank all of you, Dominique, Karen, and Tanya, for the information. I'd like to thank MC Advisory and McInnes Cooper for providing excellent resources to members of the Fredericton Chamber of Commerce. And as mentioned, we will be sharing this on our YouTube channel. We'll be sharing it on our social media as well. And certainly we will be sharing the slide presentation with those who attended. And I'd also let you know, I mean, we have many companies that can provide advice to our members on issues of this nature. But I will tell you that certainly the work that McInnes Cooper and MC Advisory has done on this topic gives them a great expertise in this area. And I know that if you were interested in developing a policy for your workplace, they'd be more than happy to help you with that. So any of these three individuals with a wealth of knowledge or their colleagues would be more than happy to help you. So I would like to thank everybody for attending today. This is one of our best attended webinars that we've had. So certainly indicates a most popular topic. And just a reminder too, that for those interested in the Fredericton Chamber of Commerce Rapid Testing Program, there's a link on our website where you can fill out an application form, set a time to pick up your tests, and we can support you in that way. So again, thanks everybody for your attendance. Thanks to our guest speakers today. And thanks to all of you for your attention and your great questions at the end as well. Thanks very much. Have a great day, everyone.
Thanks for having us. Bye.
Thanks for having us. Thanks, Krista.